Nutrition, and why is it important during pregnancy? Nutrition is about eating a healthy and balanced diet so your body gets the nutrients that it needs. Nutrients are substances and foods that our bodies need so they can function and grow. They include carbohydrates, fats, proteins, vitamins, minerals, and water. When you're pregnant, nutrition is more important than ever. You need more of many important nutrients than you did before pregnancy. Making healthy food choices every day will help you give your baby what he or she needs to develop. It will also help make sure that you and your baby gain the proper amount of weight. Nutrition during pregnancy. Findings from the National Institute of Child Health and Human Development, NICHD, Fetal Growth Studies Singleton Cohort. Background. Accumulating evidence indicates that maternal diets are important for optimizing maternal and offspring health. Existing research lacks comprehensive profiles of maternal diets throughout pregnancy, especially in a racially/ethnically diverse obstetrical population. Objective? The aim was to characterize diets in a longitudinal U.S. pregnancy cohort by trimester, race/ethnicity, and pre-pregnancy BMI. Methods. Data were obtained from pregnant women in the Eunice Kennedy Shriver National Institute of Child Health and Human Development, NICHD, Fetal Growth Studies Singleton Cohort, 2009 to 2013. A Food Frequency Questionnaire, FFQ, at 8 to 13 weeks of gestation assessed periconception and first trimester diet, N equals 1615, automated, self-administered, 24-hour dietary recalls targeted at 16 to 22, 24 to 29, 30 to 33, and 34 to 37 weeks of gestation assessed second and third trimester diets, N equals 1817 women/6791 recalls. The Healthy Eating Index 2010, HEY 2010, assessed diet quality, i.e., adherence to U.S. dietary guidelines. Variations in weighted energy adjusted means for foods and nutrients were examined by trimester, self-identified race/ethnicity, and self-reported pre-pregnancy BMI. Results. Mean, 95% C, HEY 2010 was 65.9, 64.9, 67.0, during periconception to the first trimester assessed with an FFQ and 51.6, 50.8, 52.4, and 51.5, 50.7, 52.3, during the second trimester and third trimester, respectively, assessed using 24-hour recalls. No significant differences were observed between the second and third trimester in macronutrients, micronutrients, foods, or HEY 2010 components, P greater than or equal to 0.05. Periconception to first trimester HEY 2010 was highest among Asian/Pacific Islander, 67.2, 65.9, 68.6, and lowest among non-Hispanic Black, 58.7, 57.5, 60.0, women and highest among women with normal weight, 67.2, 66.1, 68.4, and lowest among women with obesity, 63.5, 62.1, 64.9. Similar rankings were observed in the second/third trimesters. Conclusions. Most pregnant women in this cohort reported dietary intakes that, on average, did not meet U.S. dietary guidelines for non-pregnant individuals. Also, diet differed across race/ethnic groups and by pre-pregnancy BMI, with the lowest overall dietary quality in all trimesters among non-Hispanic Black women and women with obesity. No meaningful changes in dietary intake were observed between the second and third trimesters. Do I have any special nutrition needs now that I am pregnant? Iron is important for your baby's growth and brain development. During pregnancy, the amount of blood in your body increases, so you need more iron for yourself and your growing baby. You should get 27 milligrams of iron a day. Calcium during pregnancy can reduce your risk of preeclampsia, a serious medical condition that causes a sudden increase in blood pressure. Calcium also builds up your baby's bones and teeth. Pregnant adults should get 1000 milligrams of calcium a day. Pregnant teenagers, ages 14 to 18, need 1300 milligrams of calcium a day. Vitamin D helps the calcium to build up the baby's bones and teeth. All women, pregnant or not, should be getting 600 IU, international units, of vitamin D per day. Keep in mind that not all calories are equal. You should eat healthy foods that are packed with nutrients, not empty calories such as those found in soft drinks, candies, and desserts. You need more folic acid, iron, calcium, and vitamin D than you did before pregnancy. Folic acid is a B vitamin that may help prevent certain birth defects. Before pregnancy, you need 400 micrograms per day. During pregnancy and when breastfeeding, you need 600 micrograms per day from foods or vitamins. It is hard to get this amount from foods alone, so you need to take a supplement that contains folic acid. What foods should I avoid during pregnancy? During pregnancy, you should avoid alcohol. There is no known amount of alcohol that is safe for a woman to drink during pregnancy. Fish that may have high levels of mercury, limit white, albacore, tuna to 6 ounces per week. Do not eat tilefish, shark, swordfish, or king mackerel. Foods that are more likely to contain germs that could cause foodborne illness, including refrigerated smoked seafood like whitefish, salmon, and mackerel. Hot dogs or deli meats unless steaming hot. Refrigerated meat spreads. Unpasteurized milk or juices. Store-made salads, such as chicken, egg, or tuna salad. Unpasteurized soft cheeses, such as unpasteurized feta, brie, queso blanco, queso fresco, and blue cheeses. Raw sprouts of any kind, including alfalfa, clover, radish, and mung bean. Too much caffeine. Drinking high amounts of caffeine may be harmful for your baby. This is the amount in about 12 ounces of coffee, but more research is needed. Check with your healthcare provider about whether drinking a limited amount of caffeine is okay for you. Small or moderate amounts of caffeine, less than 200 milligrams per day, appear to be safe during pregnancy.